NHS watchdog for England, the National Institute for Health and Care Excellence, has suggested that doctors should challenge colleagues they believe are over-prescribing antibiotics. The draft guidelines aim to tackle the rising problem of drug-resistant infections and recommend that GPs should also explain to patients who may expect to be given the drugs why they're not always the best option. Well, research into antibiotic-resistant bugs and over-prescribing has also previously been carried out in Scotland. And a little earlier, I spoke to Dr. Robbie Cool, a GP from Strucher in Argyll, about his opinion of the NICE guidelines.
The main issue from the GP's perspective is going to be, obviously, of course, the NICE guidelines apply to England, obviously. The main issue is going to be with monitoring other GPs prescribing. I think has come up in the story today as being sort of a little controversial, and peer review, and then, of course, there'll be funding for that.
Yeah, I mean, it's hard to imagine how you're actually going to monitor your colleagues' prescribing of antibiotics. Yeah,
I mean, we've known how to do this for quite a long time. Depressingly, I've been talking about this since I was a medical student, which was a while ago now. We know that we need to reduce the prescribing. We know in many ways how to do that from the point of view of guidelines, but it's not actually happening. And we do know that it has to happen at practice level, so it has to happen at an organisational level. Everybody in the practice has to sing into the same song sheet. How we do that, though, is quite interesting. And that falls down to a leadership problem. And there's been a lot of work done on that recently. And if you look at the 2011 systematic review, which looked at why this wasn't happening, one of the main things they got up with was they weren't looking at the behavioural aspects. So we know what to do. Why is it not happening? And that's actually quite complex when you look at it. And then you have to look at how do you change the way people actually behave, both patients and doctors, particularly doctors in this case, because we've been working on patients for a while on this. And that's not as easy as it sounds, actually.
Yeah, I mean, it must be quite awkward, actually. It is a business situation for you to pull up, I guess, one of your business partners and say, well, you're giving out too many of these things.
Well, yeah, that would be tricky. I think more commonly what we do is we actually get data coming through saying how many antibiotics we're prescribing each year, and I think it's much more common for us to sit down over coffee and we discuss these things anyway. Should
it not be centralised, though? Somebody, I guess in some centre somewhere monitoring, well, this guy's obviously doing far too much, rather than your own colleagues having to do it.
That already happens as well. I mean, one of the fantastic things about the UK having worked abroad, one of the great things about the NHS is we have all this data. And so you have the pharmacist will come around from the health board and discuss with you how much you're prescribing. One of the problems with that, of course, is it's aggregate data, and it can get quite tricky. As you might have reasons for it. You might have a bunch of people who maybe have had kidney dialysis or whatever, and or who are on chemo and need more than normal of these type of antibiotics. But it is difficult.
Why do you think then some GPs, if not many GPs, are over-prescribing?
That's a good question. Are they overprescribing? I think they are overprescribing. The main issue is there's a lot of factors to it, and it's not been researched very well. But if you look at the behavioural aspects just around the water cooler, shall we say, a lot of it may revolve around misunderstanding and fear between the GP and the patient. The patient is obviously afraid because they are not well, so they have fear aspects and they can get upset and worried.
So do you think the GP is feeling under pressure to be seen to be doing something?
Well, they certainly feel under pressure to be seen to be doing something. The person's come to see them, they're not well, they've come in, and GPs want to help. I think also, of course, GPs traditionally are extremely non-confrontational with the patients. We know them well. We've had the patients for years, and we have a long-term relationship with them. That can be tricky if you have to then challenge them, particularly when they're frightened and they want something and they dig their heels in and they get upset. We all become more childlike when we're unwell. I've just been unwell myself recently with a cold, and I was more childlike, and so it's difficult. How do you manage that without upsetting somebody, without losing that relationship? And I think a lot of GPs fear that. The researchers, they probably overfear it. If you look at, sometimes they imagine that fear when it's not there. I think another big aspect, of course, is the complaints culture. Not so much from the patients, but from the organisations that oversee us. At my appraisal and every GP's appraisal each year, we have to discuss our complaints, and it is very much viewed that any complaints are bad. Now, if you have a culture that any complaint is bad, but you're likely to complain if you say no to antibiotics, then the take-home message for you is you should be giving out what people want. And that's a tricky one. I think we need to change that culture to say, if you're going to exert leadership, you're probably going to need to be willing to take a few more complaints.
That is Dr. Robbie Cool there from Strucher.